brought to you by Airbnb and Small Business Majority. We're so happy to have you on here today. We'll be sharing with you a lot of information today about healthcare and what that means for you all as entrepreneurs. And we're really excited today to be joined by our partners at Airbnb. So I want to turn it over to Ricardo Ramos just to talk momentarily about Airbnb and their commitment to providing this information. Ricardo, really great to have you here. Really looking forward to our partnership today and going forward. Ricardo, take it away.
Thank you, David, and good afternoon, everyone. Thank you for joining us, and thank you again to David and Bianca and the rest of the team at the Small Business Majority. Like David said, my name is Ricardo Ramos, and I'm a Global Organizing Manager for Airbnb. And my team main directive is to advise regional teams all around the world on content, strategy, and operation for the creation of tools and resources for the teams that engage with our community in Airbnb. For me personally, it's particularly rewarding to join David and the rest of the SBN team because I strongly believe in the power of supporting communities to generate success and change people's life for the better. That's why I got this job. That's why I'm happy doing it. And this specific topic, healthcare, is one that is very close to my heart, and I'm glad that we were able to partner with the Small Business Majority. That is a nonprofit that is run and started by small businesses and entrepreneurs, and whose mission is so akin to ours, that believes in this stakeholder approach to communities and really serving and strengthening the local communities. So I'm not going to talk about anything that has related to healthcare. That's why the experts are here for. We just wanted in Airbnb to supply our community to this link so that they can connect with the Small Business Majority and all the resources that they have. And this webinar is part of that partnership that we hope that we can expand in the future. And with that, I'll just leave you, David, to enlighten us with the information and the resources that you have.
All right. Well, thank you so much, Ricardo. Again, we really are really excited about our partnership with Airbnb and glad to have you here today. So thank you for that. Thank you for your comments. All right, we will dive in here. I'll just spend just a second telling you a little bit about Small Business Majority. For those of you that are not familiar with our organization, welcome. We're really glad to have you here today. So Small Business Majority is a national education and advocacy organization that has been founded and run by small business owners. We have offices across the country where we work in communities directly with small business owners day in and day out, learning about the challenges that you all are facing as entrepreneurs, and we work with them collaboratively to address those challenges with solutions. We focus on issues that we know are important to the self-employed and to small employers. Those issues include access to capital, retirement, entrepreneurship, taxes, and of course healthcare, which we'll be talking about today. And all of our work is supported by extensive research. We'll talk a little bit about that today. We regularly do a national opinion polling of small business owners across the country, asking them how they feel about a variety of topics, and we use all that data to inform the work that we do. We also have an online resource hub. It's called venturize.org. It's an online portal where we have a lot of information about healthcare, about access to loans, retirement, a lot of information that's very practical for small business owners, and it's a website that we maintain, and we are constantly adding new resources to it. So we would encourage you to check it out and see what might be useful to you. So first, we're going to start off with a few recent updates to the Affordable Care Act, also known as Obamacare. You may have heard about some of these changes recently in the news, and we want to kind of clear up any sort of confusion, misinformation that might be out there. So starting off, you may have heard about some Supreme Court cases, lawsuits that have been filed related to the Affordable Care Act. In December of 2018, there was a case called Texas versus the United States. A judge ruled about a year ago that the Affordable Care Act is unconstitutional. and that court case has been making its way all the way up to the Supreme Court. We're expecting a decision really any day now. But it's important to know that while this lawsuit goes on, the law is still the law of the land. It still remains totally in effect. It's as if the lawsuit, wasn't even around. So a lot of folks might be confused, but it's important to know that the healthcare law is still the law of the land. It's still time to enroll in coverage. It's still open for business, despite the lawsuit that is still pending. And in fact, we're actually in the open enrollment period right now, which we'll talk a little bit about later on in the presentation. So the healthcare law is very much still alive, and now really is the time to get enrolled. A couple of changes that you may have heard about that are related to the Affordable Care Act, in particular related to small businesses. There's two things we wanted to talk about that have been recent changes. The association health plans. This is an idea that the federal administration has been behind. The idea is to allow small businesses to group together and buy insurance across state lines. So it's important to note if you're looking at something like this, if you're looking at an association health plan, and you're buying a plan that is sold across state lines, that means whatever rules your state has that insurance companies need to comply with, rules they need to play by, benefits that they might need to include, limits on premiums or deductibles or networks, any sort of rules that your state puts on insurance companies do not apply to association health plans. And so they're not able to regulate them. So it's really important to sort of read the fine print when you're looking at these association health plans, because they might be very different than the plans you're used to buying, which do have to comply with state laws. These plans also do not need to comply with the Affordable Care Act, covering things like pre-existing conditions, those kinds of things that you've heard about under the Affordable Care Act or Obamacare. These plans do not have to comply with those rules. So throughout the presentation, we'll talk a lot about some of the rules, the regulations, the protections that are part of the Affordable Care Act. But it's important to remember, if you're looking at an association health plan, none of those ACA rules are pertinent. The same is true for the short-term plans. Sometimes these are called junk insurance. Basically, these short-term plans have been around for quite a while. Traditionally, though, historically, they've been used, for short terms. So the kind of situation is typically maybe you're going from one job to the next, and you have maybe a month or two in between jobs, and you want to have health coverage just in case something catastrophic were to happen, during those 2 months. Or perhaps you're leaving one plan and you're about to get married, or whatever the situation might be. There's some sort of life-changing sort of event, and you want to have, some sort of basic health coverage in the, 4 weeks, 6 weeks, whatever it might be. These short-term plans were sold for that purpose. And because they were only intended to be used for a short period of time, they don't cover basic benefits. They're not going to cover, maternity benefits. They're not going to cover regular checkups. They're going to cover, catastrophic things, getting hit by a bus. Those are the kind of benefits that they might cover. So now these plans are being sold for a longer period of time, up to basically a year, and then you can renew that plan for a couple of years afterwards. So you could be on these short-term plans for a few years. So they're pretty cheap because they don't cover much. So you may see those out there as a cheaper alternative, but again, you got to read the fine print. They're cheaper for a reason. They're cheaper because they don't cover basic health benefits. So something that you might want to keep in mind if you're looking at these kinds of plans. A few other changes. We're going to be talking a lot about the healthcare marketplace that is run on healthcare.gov. Healthcare.gov runs two marketplaces. One is for individuals and families. The second is for small businesses that offer a plan to their workers. It's important to note that while you can still enroll online as an individual, the Trump administration has shut down the online enrollment feature for small businesses. So we'll talk a little bit about this how that enrollment process works. There's still a small business insurance marketplace on healthcare.gov, but the enrollment process is strictly on paper, and by working with a broker, they decided to no longer allow small businesses to enroll online. And we'll talk a little bit more about that. Secondly, the individual mandate or the requirement that everybody who can afford it has insurance has been repealed. We'll talk a little bit about that later on in the presentation as well. And then lastly here, Congress and the Trump administration have been working together to expand health savings accounts and health reimbursement accounts. Some of these changes have already taken effect. Some of these changes are expected to take effect later on. So we'll talk a little bit about each of those further on in the presentation. Next, we'll just talk a little bit about premium increases. This is obviously something that you hear a lot about, a lot of headlines about premium increases going up, going down. It's important to note that in the small business market, the group market that sells insurance to small businesses and their employees, over the past few years we've been seeing single-digit increases. This is compared to double-digit increases that we saw before the Affordable Care Act. 10, 11, 12 years ago, where we were seeing 10%, 20%, 30% increases on a pretty regular basis year after year after year. The good news is that those increases are a lot smaller now. So in most states we're seeing 2, 3, 4, 5% increases. We wish we weren't seeing increases, but we'd much rather have a 3 or 4% increase rather than the 30 or 40% increase. And then in terms of premium increases in the individual market, they've been a little bit more volatile, but not as volatile as they once were many years ago. But it's important to note that in the individual marketplace, the plans that are sold through healthcare.gov, most individuals are going to qualify for a tax credit, which is significantly going to reduce the premiums. And as premiums go up, your tax credit goes up. So you might see headlines about premium increases going up by this percent or that percent. What's kind of lost in the details, I think, sometimes is that your tax credits are also going up. So you're really protected if you're eligible for these tax credits, which we'll talk more about. You're really protected against those premium increases. A few consumer protections. Some of you may be familiar with these things. They've been receiving a lot of coverage, of course, under the Affordable Care Act or Obamacare. Insurance companies cannot deny coverage to people for having a pre-existing condition. So if you're sick, insurance companies are required to still sell you a policy, and they can't charge you more because of your health condition. This is a big change from the way that insurance worked 10 years ago, where sick people were denied coverage, or you might be allowed to buy coverage, but they would significantly increase the premiums that they would charge you. That's no longer allowed. Lifetime caps on coverage have been banned as well. So in the old days, insurance companies would say, you know what, you've reached a lifetime cap. We're no longer going to pay for anything, any health care for you anymore. That's not allowed anymore. If you're paying your premiums, they still have to pay their part. Also, adult children up to age 26 can stay on their parents' plan. They don't need to live at home. They can be married. They can have their own job. They can be totally financially independent and are still allowed to be on the parents' plan. Another thing to talk about is the Affordable Care Act provides what's known as the essential health benefits. So if you're buying an ACA-compliant plan, those plans are required to include at least these 10 essential benefits. Some will include more, but they're required by federal law to include these basic things. And it includes things like ambulatory care, hospitalization, maternity, emergency services. These are baked into every plan that's out there that complies with the ACA. Now, I talked about a couple of newer options, the association health plans, the short-term plans. These are new plans that the Trump administration has brought out over the last few years that do not comply with the ACA, which means they do not have to include any of the benefits that you're looking at on your screen. So it's really important to note that if you're buying an ACA plan, you know it includes these things. If you're buying one of the newer plans we talked about, they may not include any or all of these benefits. So next we'll talk a little bit about how the Affordable Care Act impacts small business owners and the self-employed. But before we get into that, we'll take a step back and talk a little bit about historically, why was this such a big deal? Why was health reform needed for small businesses? We know that small businesses have been struggling for years with costs, and this is why about 50% of small businesses with 10 employees or fewer don't offer coverage. It's simply unaffordable. Small businesses just don't have the margins where they're able to offer a plan. Before the ACA, about a third of self-employed people were uninsured. Those numbers have gone down now, but those that are self-employed really historically have had a very difficult time being able to get health insurance. And then we know small businesses on average have paid 18% more than larger businesses and usually get fewer benefits. So there's been historically a real disparity between what small businesses are charged for health benefits and what larger companies are able to get. I mentioned earlier that Small Business Majority does a lot of scientific opinion polling. This is a snapshot from one of our polls. We asked small businesses that don't offer coverage why they're not offering. And this probably won't come as a surprise to you, but 70% of us said we can't afford it. So what we hear is a lot of business owners would like to offer that. They see it as a good way to recruit and retain a talented workforce. They care about their employees, but the costs are just too high, and they're just simply not able to do so. So cost is a major barrier and has been a major barrier for small businesses. So how has the Affordable Care Act sort of changed this? The Affordable Care Act has brought health insurance to 20 million individuals who could not have coverage before. These were previously uninsured individuals who now have coverage. And of those 20 million, that includes about 5.7 million small business employees and the self-employed. In fact, there's a hefty number of small business owners and small business employees who are enrolled in the individual marketplaces where health insurance is sold at healthcare.gov through the Affordable Care Act. More than half of all the enrollees in healthcare.gov are either small business owners, self-employed entrepreneurs, or small business employees. And in fact, small business owners or solo entrepreneurs were 3 times more likely to purchase coverage on healthcare.gov compared to any other worker. And it kind of makes sense because we know that if you work for a big business, you're very likely to get coverage through that big business. If you're self-employed or work for a small business, you're less likely to have coverage. So these individual marketplaces that have been set up through healthcare.gov, not surprisingly, are benefiting a huge number of small business owners and their workers. In the next section, we're going to talk a little bit more about the nuts and bolts in terms of navigating enrollment. So healthcare.gov is set up as a one-stop shop web portal. In some states, states have set up their own sites. You can still go to healthcare.gov to find out if your state has their own site or if they're relying on the federal government site. And we'll talk a little bit more about that later on in the presentation. Whether you're on the federal website or your state website, if your state has one, the idea of these marketplaces is that you can compare plans and easily compare them around price, quality, service. The idea is that they're set up in a way where you can really do an apples-to-apples comparison and sort of figure out, all right, what is the difference between these plans? Which one has the better benefits? Which one's cheaper? Which one is going to be better for me, my business, my employees? The plans are organized by category. So on the lower end, you have the bronze plans. On the higher end, you have the platinum plans. And we'll talk a little bit more in a minute about what each of those metals, those heavy metals, the bronze, silver, gold, platinum, what each of those mean. Small business employees and the self-employed may be eligible to receive affordability tax credits. So these are the tax credits I was mentioning earlier. These are for low-income people and middle-class people. If you're up to 400% of the federal poverty level, you're eligible for a tax credit. So you want to go to healthcare.gov. There's a calculator on their website. where it's going to ask you about your family income, your household income, how many individuals you have living in your household, what their ages are, and then it will calculate what sort of a tax credit you're eligible for. And this is an advanceable tax credit. You get it when you buy your health insurance. It's not a tax credit like most tax credits that you get at the end of the year, when you file your taxes. The healthcare law also ensures that more money goes directly to medical care. So under the ACA, for every dollar that you send to the insurance companies, they have to spend at least 80 cents on actual medical care, and leaving 20% for administrative costs, profits, that sort of thing. If they go over that 20% and they're not spending enough of your money on actual health care, they have to send it back to you as a refund. I mentioned the heavy metal tiers just a minute ago. This slide kind of gives you a better picture of how those work. So if you're on either healthcare.gov or your state website, you'll see the plans are broken down by platinum, gold, silver, and bronze. The actuarial value is sort of a very wonky kind of insurance talk, but what that means is if you buy a platinum plan, for example, on average, the insurance company is going to pay for 90% of all the costs, and the consumer, would pay 10%, and that's going to be paid through, deductibles and co-pays and that sort of thing. On the other hand, a bronze plan, obviously the insurer would pay on average about 60%, and that leaves the consumer paying 40%. So basically how this is going to work is platinum plans are going to have higher premiums, and you're going to have low out-of-pocket costs. Deductibles, co-pays are going to be pretty low, but with the higher premiums that you pay every month. Bronze plans are going to be the exact opposite of that. So your monthly premium that you pay is going to be a lot lower, the lowest, but you're going to have higher costs, out-of-pocket costs to pay every time that you actually use your health insurance. So depending on how your health condition, how often you go to the doctor, what your monthly budget is, all those sort of factors are going to help to determine, which sort of tier makes the most sense for you and your family or your employees. I mentioned the financial assistance that is available for low and middle income households. Again, that goes from 100 to 400% of federal poverty level. For a family of four, that's roughly about $100,000 a year. So again, check out the calculator. You can put in your specifics to sort of figure out exactly what you might be eligible for, what your family might be eligible for, or your employees might be eligible for. Some low-income families also receive assistance for cost sharing. So in addition to the tax credits that you get to lower your monthly premiums, some will be eligible for cost sharing reductions as well. So this is co-pays, deductibles, that sort of thing. The marketplace will calculate the eligibility and manage the premium adjustments. Again, you can check out the calculator and figure exactly how that is done. There's one application process that will figure out what you're eligible for, if you're eligible for a tax credit, or perhaps if you're on the lower income side, you might be eligible for Medicaid. Your children, if you have some, might be eligible for the Children's Health Program. So it'll sort of figure out what's your situation, what's your family like, how much money you have coming in, and we'll tell you, which program you are eligible for. I mentioned at the start of the call that the individual mandate had been repealed. Basically, they kept the requirement, but they got rid of the penalty. So there's no longer a penalty for not having health insurance. This was repealed as part of the tax bill in 2017, and the first year that it actually went into effect is 2019. So this means that if you're not insured, you haven't been insured in 2019, when you do your taxes in 2020, you will not pay a penalty. Maybe you paid one in the past, you will not pay a penalty in 2020. So while there's no penalty, it's important to note that the tax credits, the assistance, the subsidies that I've been mentioning in the individual market are still available. So there's no penalty for not having coverage, but there still is financial assistance to help you purchase coverage if you are interested in doing so. So just because there's no requirement that you have health coverage, it's obviously still a good idea to have health insurance, and we encourage small business owners and freelancers to check out their healthcare options and see what might make sense for them. In terms of qualifying for one of the tax credits or subsidies that's available in the individual marketplace through healthcare.gov or your state system, here's an example. Family of four, couple of adults, couple of children, $80,000 annual household income. If they were to buy a silver plan on their own, they'd be looking at about $19,000 a year, or roughly $1,600 a month in monthly premiums. With those particular statistics, they would be eligible for a premium assistance or a tax credit, and that tax credit would be about $12,000 a year, or just over $1,000 a month. So full freight with no tax credit, they'd be paying $1,600, but they get a $1,000 tax credit. So you can see, it cuts their bill down, by almost a third. So there's a significant savings here with these tax credits. We're not talking, small pocket change. In many cases, again, depending on your particular family, there are significant savings to be had. So we really encourage you all to check out the calculator. I want to talk a little bit about open enrollment and how this works for individuals enrolling through healthcare.gov. You cannot enroll year-round. The federal government sets an enrollment period, which began on November 1st, 2019. It ends just in a few days. It ends on December 15th, 2019. If you enroll during that period, your new coverage will begin on January 1st, 2020, and that's it. This period used to be longer under the Obama administration. The Trump administration decided to shorten that period. So if you're under the federal system, this is the time to buy health coverage. If you are under a state system, they may have a different open enrollment period, so check that out. But it's important to know that for many states, the deadline is just a few days away, December 15th. After that, you're not able to buy health coverage. There's a few exceptions, which I'll talk about in a minute, but in most situations, if you're buying as an individual for yourself, your family, you have to enroll by December 15th. Now, if you're buying a group plan, a small business plan for your employees, you can enroll year-round. So you don't have to worry about the deadline if you're buying a group plan for your employees. So if you don't enroll by December 15th, there are a couple of exceptions, what's called a special open enrollment period. So there's a recognition that there are life-changing events, getting married, having a baby, changing jobs, that might cause you to lose coverage and need to purchase new coverage, outside of that open enrollment period. So if you get married in March and you want to switch over, you're losing coverage, or you're changing jobs, and it's March, April, May, whatever the case may be, and you experience one of those types of situations, you typically can enroll under what's called a special enrollment period. It's not automatic, though. It used to be a little bit simpler. Over the past few years, the federal government has changed this, so there's more paperwork. There's a pre-screen requirement. They make you kind of jump through a few hoops to make sure that you really did get married, or you really did have a baby. You're not trying to game the system. So they have been adding some rules there. So if you think you might qualify, for a special enrollment period, check it out. But be prepared to fill out some paperwork. And you can find out more information about this on healthcare.gov. So we've been talking a lot about the individual marketplace. Healthcare.gov sells insurance individual plans to families and individuals. There's also what's called the Small Business Health Options Program. States have this. There's the federal government that runs this, and it's a large marketplace that sells health insurance to small businesses. You can still use a broker. If you're under the federal system, if your state has not set up their own system, but they're relying on the federal healthcare.gov, as I mentioned earlier, that system has been shut down. Small businesses under the federal system cannot enroll online. You can still enroll, but it's via paper. In some states that have their own marketplaces, their own exchanges, they're likely still going to have the small business enrollment. So it depends on your state, whether your state has sort of taken over and controlled this themselves, or if they've opted to have the federal government run it. So the idea behind the Small Business Health Options Plan is that private insurance companies compete for your business. So you say, all right, here's my business, here's how many employees I have, what plans do I have available? These are all private plans, and you can sort of pick which one makes the most sense for you. To be eligible, this is for businesses with 50 employees or fewer. And again, the group enrollment period never closes. So there's a limited enrollment period for individuals, but for small businesses that are enrolling their employees and dependents, that period stays open year-round. So how is the SHOP marketplace, the small business marketplace, different from any other way that small businesses have bought health coverage? One is there's a tax credit available. If you buy coverage through the small business marketplace, some businesses are eligible for a tax credit, depending on the type of, the size of business that you run and the income of your employees. You can browse plans by price, service level coverage. Sort of more allows for that apples to apples comparison we talked about earlier. How is it similar to buying health insurance, maybe the way that you used to buy health insurance for a small business? It's very similar. So you're still buying a private insurance plan like you're used to. This is certainly not the only way to buy coverage. This is just one additional option that's available. And you can still use a broker. In fact, using a broker probably makes the most sense since the administration has shut down the small business online enrollment option. It's going to be easier to work with a broker, and there's no charge for doing so. So for a number of years, there's been a lot of talk about the so-called employer mandate that's part of the Affordable Care Act. So we wanted to talk just a little bit about what that employer mandate is, how it works, that sort of thing. It's important to note that small businesses with 50 employees or fewer are totally exempt from this requirement. So if you're 50 or smaller, you do not have to offer health coverage, not now, not going forward, and there's no penalty for not offering coverage. It's totally up to you. And that accounts for about 96% of all the businesses in the country have 50 or fewer. Most of them are not even close to 50. So we're talking about 4% of businesses that are big enough, they have enough employees to be subject to this requirement. Most of those businesses have offered coverage for years and have done so voluntarily. When you're that size, when you're a bigger business, you typically offer coverage. It's just sort of part of their culture. So there's very few businesses that are over 50 and don't offer coverage. In fact, it's about 0.16% of all businesses in the country that are over 50 employees and don't offer coverage. So the employer requirement is not really going to be impacting too many businesses because of those things. I mentioned the Congress and the Trump administration have recently been expanding health reimbursement accounts. So originally when the ACA was passed back in 2010, if employers offered a group insurance plan, they were allowed to also offer an HRA, a health reimbursement account or arrangement, in addition to their group plan. What you weren't allowed to do anymore under the ACA was just offer an HRA. An HRA is an account that you make available to your employees. If they go out and have health insurance costs on their own, they can be reimbursed by the money that the employer puts in the HRA. And so the ACA said, nope, you can't do that. No more standalone HRAs. You can't just offer an HRA to your employees. A few years ago, Congress decided that didn't really make a whole lot of sense and allowed small businesses with 50 employees or fewer to go back to allowing standalone HRAs. And this is something that small business majority was proud to support because we know we want options available, particularly for smaller businesses. Whatever option is out there, we want to make sure that they're good for the employer and good for the employee. But we were interested in bringing back this option. As I mentioned, the administration is also considering changes that would make these HRAs more broadly available. So some of the rules might be changing over the next few months and years. But this is just another option if you have 50 employees or fewer. These standalone HRAs are available. Basically, the employer would put money in an account. The employee would have to go buy their own health insurance, but they could be reimbursed a portion of that amount from the money that you put into the HRA. Another requirement that we should mention is that under the Affordable Care Act, many employers are required to notify their employees of the coverage that we've been talking about, the health coverage that's available on healthcare.gov. Employers are required to give a notice to employees that says, hey, you might be eligible for health coverage. It's a piece of paper you can download on the internet, but we want to make sure that you know about this requirement and know how to get it. There's 2 notices available. One is for businesses that do offer coverage. One is for businesses that do not offer coverage. So you can see the link there on the Department of Labor website. We would encourage you to check that out. Make sure you have those forms and that you are giving those to your employees just so that you can be in compliance with the law. A few other things in terms of navigating enrollment. Expanded health coverage options are available in the individual marketplace, SHOP, and Medicaid, as we've been talking about. Again, there's financial assistance, tax credits in the individual marketplace and the small business marketplace. So look for that. We mentioned brokers. They can offer free face-to-face help. There's also people called navigators that might be able to help you. There's no charge for working with these individuals. So we really encourage small businesses who probably don't have an HR department or a benefits administrator to get some help. And remember to contact the health marketplace, healthcare.gov, or your state system regarding any significant income changes that you might experience throughout the year. So you use that calculator, you figure out what tax credit you're eligible for, you enroll in a health plan, maybe your income goes up or down, there's other changes to your household status throughout the year. You need to report those because if they're paying you, too much in tax credits, you'll have to pay them back. Or maybe your tax credit will actually increase depending on what changes have happened in your life. So it's always a good practice to make sure that as income changes, your household status changes, that you report that to the marketplace. So lastly, we'll talk a little bit about resources, additional resources that are available to you as a small business to learn more about the topics that we've learned to talk about today and other issues as well. Venturize.org is a website that we run. It's an online resource portal. It includes a lot of very practical information about healthcare options like we've covered today. It also covers issues much broader than just healthcare. So we'll cover information about how to get access to loans and capital, retirement accounts for yourself, your employees, other resources. What we can direct you to local help in many areas. So we encourage you to check out Venturize.org. We think it has a lot of information that we know is important to you all as small business owners. Healthcare.gov, again, this is the dedicated site that is set up by the federal government. It's run by the Health and Human Services. This is where you actually can enroll in health insurance as an individual, and you can get information about the small business marketplace. So as I've been mentioning, some states have their own system. When the ACA was set up many years ago, states had the option to set up their own marketplaces or rely on the federal government to do so. So some states said, yeah, we'll take that on ourselves. Other states said, no thanks, federal government, you can do it for us. So if you go to healthcare.gov, tell them what state you're in, they will say, hey, your state has their own page. Here's the link. Check it out. It'll redirect you. Or if your state doesn't have an exchange, doesn't have their own marketplace, then it'll tell you that as well, and you can use healthcare.gov. So you can get information on these calculators to determine what tax credit you might be eligible. Another cool feature for small businesses is a calculator for determining full-time equivalents. So I talked a little bit about this. Do you have 50 employees or more or less? That dictates whether you're eligible for the standalone HRAs, some of the tax credits I mentioned, some of the employer requirements. So if you want to figure out, if you're sort of close, sometimes it can be confusing when you think about your seasonal workers and part-time workers. Well, how does that how's that calculated when we're talking about full-time equivalents? You can figure all that out on the website, healthcare.gov. Other resources. We want to be a resource to you at Small Business Majority. We have a monthly newsletter we'd be happy to send to you. We're always looking for stories, your stories as entrepreneurs, to share with the media and with other lawmakers, decision makers. We want to help you get your story out there. Have you had a good experience, a bad experience with healthcare? Do you have challenges on retirement savings? Do you have challenges getting a loan? We want to help you tell your story, and we have a whole team of people here at Small Business Majority that would be delighted to work with you to help you talk to reporters, draft letters to the editor or op-eds and get them published in your local newspaper. We have events where you can come in person and learn information like we learned today on today's webinar. Occasionally we fly small business owners to Washington, D.C. to meet with their lawmakers there. We've done the same thing at the state level. We have webinars like this. We're on social media. There's a lot of different ways to connect with us. We really encourage you to check us out. We would love to work more with you, to help you tell your story, and to provide you with tools and resources that you might need to run your business. If you have other questions that you think of tonight or tomorrow or next week, I'd be happy to chat with you. You can see my information here up on the screen, and would be happy to connect, let you know a little bit more about healthcare, or just tell you a little bit more about small business majority in general. So with that, we're going to move into the Q&A section of today's call. A few of you have already been sending in great questions through the chat box there on your screen. If anybody else has a question, feel free to chat those into the Q&A box on your screen, and we will get to answer those. So we have a question here from Christiane, who's asking, my COBRA expires March 30th, 2020. When do I need to lock my new plan in? I'll be buying an Obamacare plan as a small business. So because you are moving from one plan to the next, you would likely be eligible for the special enrollment period that I talked about. So I would check this out on healthcare.gov. I want to, you want to check out the specifics with your particular situation to make sure that you'd be qualified for that. As I mentioned, it's gotten a little bit more difficult to qualify over the past few years. Lillian is asking, she's on Medicare, and what's the difference between it and other insurance? Do I have an option on which to choose? So the big difference is Medicare is a public insurance. The government is the insurance company if you're on Medicare. That's not what we're talking about here. We're talking about the Affordable Care Act, which is all private insurance companies. So it's private insurance companies that I'm sure you're well familiar with. So that's the big difference between Medicare. That is public insurance. We're talking about private insurance. We have another question about the financial assistance or subsidies. Is the financial assistance based on your stated income or last year's tax return? That's an excellent question. It's stated on, it's based on your stated income. So you go to the website, they ask you, what is your income currently? How many people in your family are there? What are their ages? It's all current information. That's why it's really important to keep that information updated. If your income happens to fluctuate, you change jobs, you get a promotion, whatever the situation might be, it's really important to keep healthcare.gov updated about any changes that you experience throughout the year in healthcare, and make sure healthcare.gov knows about that. What happens at the end of the year when you file your taxes, then you report your actual income, how much money you actually made, and then they figure out, well, all right, so how much of that tax credit were you actually eligible for? In some cases, if you had underreported your income, you may have to pay that tax credit back, or at least a portion of it. If you've overreported your income, then you might actually get extra money. But it's really important to keep that information updated so that you don't end up underreporting your income, earning more than you tell them that you make. You have to pay it back at the end of the year all at once, which can be kind of difficult. Nikki's asking, can you purchase through SHOP as a business of one with intent to hire talent in 2020 to add to the health insurance plan? Great question. Unfortunately, no, you cannot. You have to have at least 2 employees, and those 2 employees cannot be spouses. You have to have at least 1 employee who's not your spouse in order to qualify for the small business or the SHOP plan. We've got a question about emailing us a recording of the webinar after the webinar ends. Yeah, great question. So the webinar actually is being recorded, and so it will be available for download afterwards. We'll also be able to send you all a copy of today's slides. There was a lot of information in today's presentation, and really want to make sure that you have all that available to you. We asked a question about the tax credit calculator. Again, that can be found on healthcare.gov. That's where you can get that tax credit calculator. And then we have another question from Lisa here. She's asking, I joined Airbnb as a host in May of this year, but I also work full-time at an employer who does not offer any health insurance. Would I still be considered a small business owner if I work elsewhere? Yeah. So if you are, if you're, with Airbnb as a host, you are considered a small business owner, even if you have a regular W-2 job. But if your W-2 employer is not offering health insurance, then you are eligible to buy individual coverage. So what I would do is go to healthcare.gov and see if you qualify for the tax credits that we mentioned, and you can purchase coverage as an individual, being just one person for yourself or your family, and you might be eligible for the tax credits there. So that looks like it's the last question that we have currently in the queue. So I want to thank you all for the great questions. Thank you all for joining us today. Again, look for a copy of today's slides so you can revisit any of this information. Please contact us at Small Business Majority. We'd love to continue to working with you. I also want to thank Ricardo for joining. We're really happy to be partnering with Airbnb, really happy to be able to speak with all of you today. So thank you, Ricardo. Thank you all for joining. And this concludes today's webinar. Thank you.
Thank you all. Thank you, David.